Hey, good morning, everybody. This is Brittany Jennings coming to you live over Zoom, and I'm with the Seniors Blue Book. Today I'm joined by Stephen Martin from Approved
Hi.
Home Health. Good morning, Stephen.
Good morning, Brittany, and good morning, everyone.
We didn't even text each other this morning to match with our blues.
Nope, it just happened that way.
But if I wear blue now, I'll match you. So I like
Yes,
that.
blue is my favorite color, so yes.
So I see that you're coming to us from your studio at your home. How's everything going working from home?
Things are going well. It's certainly been interesting working from home while having a high school student doing school from home, but I've been able to still luckily do most of my job with Approved Home Health. I'm a liaison, so I help onboard new business and help get new clients set up. So a lot of that I've been able to do over DocuSign. So I am mostly working from home now. I've had to go out once or twice for people that don't have internet access because they can't do the paperwork over online then. But we're taking all the precautions in general, and working from home has been, luckily with my studio, it makes it pretty easy.
Yeah, you look real good in there.
Thank
So
you.
tell us a little bit about Approved and some of the services that maybe some of the more popular services you guys have been getting phone calls for, but kind of cover that spectrum of care and services.
Yeah, of course. I mean, as many of your viewers, I'm sure, are aware, because they are very well educated thanks to all of the videos you do. But being a private duty home health company, we have home health aides and CNAs that are caregivers to provide hands-on care for you or your loved one in your home, wherever that home may be. And so we've always run that gambit of caring for high-skilled people who need a lot of hands-on care, need help with toileting and showering and getting up and down, and need us to make all of their meals and help them with the eating and all that hands-on heavy care that you think of, especially with end of life, being that we are a sister company to Tidewell Hospice. But we also have clients that are very younger and active seniors in the community that just need that little bit of extra help, whether it be with socialization or with help around the house, getting like their meals prepped, making sure that they're filling their med organizer properly and just giving them medication reminders, helping them with shopping. And that's really where we've been going lately with this, as well as we have a lot of new clients that are just using us to help them kind of be personal assistants and go out and about and be their boots on the ground, picking up their prescriptions from the pharmacy and going out and getting them their groceries so that they have what they need and they can stay home safe.
Definitely. I think right now, I mean, even before obviously, but more than ever, people are wanting to stay home as much as they can. And so your company basically can do it all for them. And I know we do get a lot of people that watch these videos and they understand what private duty home health is. But with your guys' company, you guys have the full spectrum of care with, each of your sistering companies. So you have Avidity, which is the Medicare home health, Approved,
Yes. Yep.
Tidewell, and you also have
Yep.
Connexus too.
Yeah, we are all owned by Stratum Health Systems, so we are all nonprofits owned by the same company that end up servicing Sarasota and Manatee County, as well as Charlotte and Lee, and further on for some of our services. But Approved is the private duty side, but you're right, we have Tidewell Hospice, which is how most people know of us, but we also have the branch of Avidity, which has the skilled home health or Medicare home health if you need therapies in home. And then Nexus being mobile physicians that will go out to facilities to help provide care out in the community if they can't make it out to the doctors themselves. So we try and make this nice network of care where, you might start with us just needing a little bit of help around the house, but when you need those other services, you already have this system of experts that all work together that will help make sure you're getting the care you need.
Definitely. And you mentioned like facilities, communities, so assisted living, skilled. Can you guys provide staff to those buildings if they're in need right now?
Yeah, and that's one thing that we've been doing consistently for a while, but especially now with, especially in assisted living facilities, and skilled staffing can always be an issue. And so we do staffing for our community in a couple local facilities that are having great success, and we are still accepting new facilities as clients as well. So we do staffing at a great competitive rate, and so that is something definitely to give me a call about if you were interested in, because we have that same level of care you expect from the Tidal people that are already in your building, but just from the private duty side.
Awesome. And you mentioned too, like I know right now, having actual staff is a concern for not only this is even before what's this challenging time, but you guys also you through Tidewell, you were explaining to me that you have almost like double now the amount of staff that are able to help with these cases for Approved, right?
Yeah, and that's something that was big news for us, and it's actually breaking news because it came out this week. But well, that's something that most companies, whether you're a facility or a home health company, there's always that struggle of supply and demand of having the caregivers available to be able to provide that care. And so, being that we have this huge network of caregivers on our with our sister company Tidewell, we've been working it out with HR and how to kind of share employees, and that's all finally gone through. So the amount of caregivers we have access to now to help fill shifts in the community to make sure that caregivers are showing up and they're showing up on time and that they're prepared and qualified has just made it so much easier now that question is out of the question now. It's out the window.
That's awesome. That's awesome. I didn't realize it was such breaking news, so I feel like we're like breaking news.
Yeah, it's very special.
Breaking news on the Sun Coast.
Yes.
And so if somebody's listening and they're wanting 2 hours, 4 hours, a couple days a week, tell us kind of what is the process, and do you have a minimum number of hours that you're, for people in their homes to get care?
Yes, we do have a 4-hour shift minimum. And that's because we've done studies and research and found that that is the minimum, that you'll also get reliable caregivers to show up for their shift and take it seriously and be able to get what they need to get done accomplished with the person they're caring for. We've tried in the past 2 or 3 hour shifts, and we found that either caregivers are more likely to call off, or the person receiving the care needs all these things and it's not enough time, and so it becomes a rush. And so the 4 hours is that sweet spot minimum we found to make sure they're getting the right care that they need. And then from there, it can be 4 hours, 8 hours, 12 hours, 24 hours, 5 hours, however much you need. Awesome. We have some clients where we help 4 hours in the morning, and then we come back 4 hours in the evening. So we just help them get up and get back to bed.
Very cool. What does that intake process look like?
Well, typically, I would come out and I would meet with you and your loved one in person and do a very thorough, intake paperwork and all the assessment and answer all the questions in person. However, currently, we are doing that mostly through DocuSign when possible. However, if that's unavailable, I will be sure to work with your loved one to make sure that they can help get that paperwork completed. But yes, completing it on DocuSign, going over just the basic HIPAA forms that allow us to, provide care, and consent forms and billing forms and all of the technical forms I handle. And then our nurse, Jenny, or Wundell, depending on what part of the community you're in, will call and schedule an assessment where they would come out and assess your loved one and make the nursing plan of care. Meanwhile, our office staff is getting the family or the power of attorney or the rest of the client themselves set up with our online portal, the living room, so that the families can log in and see who's about to be the caregiver for that scheduled shift. And as they go through that nursing assessment that our nurse then puts into that program, they're able to then log on later and see, like, my caregiver did do all of these things for mom today. So we work on trying to get the care set up with the nursing side while the ops is getting the technical side ready for you guys, because that's something that also I found helps families phenomenally that not a lot of other companies have, is that technology where you can log onto a portal and see how that care is going for your loved one and what that actually looks like on a day-to-day basis.
I know, especially in our area, there's so many, our aging population, our seniors have moved here, but their families live in California or New York or wherever it might be. So for them to be able to log into this portal and see that, mom got her medications, these meals were cooked, light housekeeping, whatever it might be, she got a shower today, that's really reassuring for your clients.
Yeah, and I mean, a lot of these times, especially having that it's a stranger in your home that first time or two, we do our best to make sure that your caregiver is consistent. Mm-hmm. But that first time, especially, they're a stranger coming into your house. So it makes it a little bit easier knowing that, we give you that background information, and later that you can see on the computer, this Tiffany isn't a stranger. Tiffany, looks like this, and she's been with the company for this long, and she specializes in this kind of care, and like she'll be coming to see me these 3 days this week. Like, it makes it that much more personal, where when that person knocks on the door, it's not a complete stranger walking into your home. You already know a little bit about them, so it helps eliminate some of that fear or confusion or hesitance at first.
Yeah, I like that. It's like a caregiver profile.
Yeah, exactly.
Well, let's talk a little bit and switch gears, because I know with you in your studio, and I'm super excited for you today. So you do podcasting, and yes. I really want to touch on that because your season 2 is coming up, and I think it's going to hit home for a lot of us in the senior living industry. So talk a little bit about your podcast.
Yeah, and luckily this is something that Approved has given their full support behind, but I've been able to, in my free time with the extra social distancing and nights and weekends especially, working on my podcasting. I've been doing it as a hobby for a while with Lifetime of Happiness, which you were a big part of.
Yes, sir.
And so with that, though, everyone, when I launched the podcast in the senior living community, expected the podcast to be about senior living. Mm-hmm. That's kind of where my expertise lies. That's where all my education is and my work experience. So while it was great for me to have this hobby where I'm working on my journey for happiness, everyone kind of wanted something more. And so I've taken that feedback as well as all the tools that we've learned doing that first season of the podcast in terms of the technical side, making it so that when I present this information to the public, it's at the production quality that matches the content quality I'll be delivering. So I have everything in place now. And so Monday we are launching Senior Living on the Sun Coast.
Awesome. So, how can people find that?
Well, like most podcasts, it is absolutely free. A lot of people know of podcasts. They don't know it's a free medium. It is basically radio on demand where you can download it on any smart device, whether it be your phone, your iPad, or Kindle, or even you can set up Alexa to be able to do it. Hopefully I didn't just set her off on everyone's home.
Mine is quiet.
Okay, good. So, but it's just set, there are apps, most iPhones or Apple devices come with Apple Podcasts, but they have Stitcher or Spotify or other apps that you could download to listen to it. But it's a free listening method that I love because you can just listen to me whenever you want to and then hit pause and stop and go back and not have to worry about missing what I'm talking about. But it's all going to be about senior living across the gamut, not just about private duty home health, but in the first week we're going to be answering like what is independent living, what is assisted living, what is skilled nursing, what is memory care, before we get into private duty and Medicare home health. And we're going to try and just make sure that I'm able to give the community these tools that they need because there's not a lot of resources out there, not in person, right? Like where you can get that kind of information right now.
Absolutely. Well, I think it's awesome. And season 1 was a blast with you. So I'm excited for season 2. And do you already have all your your interview spots filled, or if people are watching and they want to be a part of it, would they just contact you for that, Stephen?
Yeah, they would definitely contact me if they're interested in being part of a future episode. I know that the first dozen that I had planned out in the pre-planning phase are pretty much all accounted for right now. And I'm on episode 10 of those now. So for at least the next week, I'm going to be working on that first dozen. But after that, I'll have some time to kind of work on the next batch of episodes. And so that would be great if anyone wants to reach out to me. Like I said, I'm trying to start with basics so that as the podcast gets later on, we can talk into more advanced topics. But I know that, especially when you first go into senior living, so much of it seems like alphabet soup. I wanted to be able to kind of help people break it down.
Awesome. Well, Stephen, you are awesome. Obviously, I think the world of you. So I'm excited that you were able to jump on with me this morning.
Yes, you as well.
I'm out of the celery fields today, so I'm actually keeping my eye out on Big Cat behind me looking for the Tiger King.
See, and meanwhile, I just assumed because you're a redhead that you had like a backdrop of Ireland or something. And so I was very surprised to hear that it was right in our backyard, and just shows how great I am with geography.
And this is not, I'm not making light of a situation, but I literally checked out flights because that made me think of travel. I checked out flights because, we go to Vegas, as we always mention, and every time we're together, I have to mention the V word, Vegas. Mm-hmm. And literally the flight here and back, round trip was $28.
What?
$28. I'm like, I could not. I just can't believe it.
The whole city's closed right now.
That's why. So, but anyways, well, I appreciate you coming on and talking about Approved and, of course, season 2 of your podcast. I'll put all your information in the post so people can check out both things. And definitely reach out to Stephen if you have any needs for in-home care.
Yes, excellent. Sounds good. Thank you, everyone. And thank you, Brittany.
Thank you. Have a wonderful day.
Have a great day. Yep. Stay happy.
Bye.